the brothers from the building trades. Can y'all make some noise?
What do we want? Where do we want it? Now!
Deborah, staffing and a raise.
What's staffing? Why is that cause a concern?
Because we're short-staffed and we need more help for the patients. The patients need more, help with. That's why we need more staffing so they can get the proper care.
How long have you been understaffed?
We've been understaffed since at least 2019. Yeah.
So that's
And
before
then
the pandemic.
even made it worse.
How did it make it worse?
Well, some people were getting sick and taken off and everything like that. And then some people were transferring to other hospitals. So basically, that's why.
Why isn't the city hiring more people? Because they have a lot of money.
We know they have a lot of money, but they just don't want to do anything. That's what I feel. That's how I feel about it.
And wages?
Oh, we really need a cost of living raise. Everything is going up, and what we're making now, we're barely surviving on that. I mean, gas going up, food going up, housing going up, rent going up, transportation going up. The Bay Bridge just went up $7 a day, So in order for people to survive and do their job right, we need a cost of living raise. We need a bigger raise. Stand up, fight back.
Valerie, fight for fair wages and better pay for all of the union members that have been keeping this city going all throughout the pandemic and have been overworked and underpaid the whole time.
The overwork, what does that cost when you're overworked?
It means lack of staff, doing the work of 2 and 3 people, working longer hours from home. It means a lot. It means that we are really tired and we have kept this city thriving throughout the pandemic, and we need to be compensated.
The city has all this money. They got money from COVID. Where's the money gone?
Your guess is your guess is as good as mine. That's what we're saying. What's happening with all that cash? We need to be paid and compensated. We are overworked.
My name is Al Barber, the guy.
So why do you think that they haven't filled the staff position?
Because they're lazy, and they've created this staff shortage because of their laziness over the years. It's not a new project. This is something that they knew about. There's over 3,000 vacant positions today. There's over $1 billion surplus, and you have vacant positions and underfunded, and then you still have folks that aren't getting help with their own work. I'm doing the job currently of 4 people. Okay, do you understand what I'm saying? 4 people. No one in their right mind would take the job that I have today if they can go work for a tech company and make twice as much money. You get what I'm saying?
What kind of work do you do?
I'm an appraiser, so I'm responsible for bringing 60% of the budget for the city. All right? So when you underpay the appraiser, the person who's responsible for the money that our schools and communities use, you're short-staffing yourself, the city, and the community. You're stealing from the city. It's people. It's residents.
Why, if they have this money and they have shortages, why aren't they filling the positions?
Shelter the homeless.
The reason they're not filling the positions is because they're lazy, and they blame the unions for that reason. It's not the reason. The reason is because management are not visionaries. They don't see how San Francisco can be just as great as Washington, D.C. It is great. It's a fantastic city. But the leaders in this building prevent it from being at its highest and best, right? And not just this building, all the other buildings that run different city services. And it has to do with management, not labor. And I want to make sure you guys understand that the labor, us, are the people who give you all services, right? Not the managers. We're the DSW workers, the disaster relief workers. We're the frontliners, and we're the people that show up every day with a smile and do what we know we need to do to make sure the communities are happy, to make sure the services are supplied, and make sure everything goes the way it's supposed to go in sunny San Francisco.
Clarito Balquedra.
What kind of work do you do?
I work for the Muni. I do the F line.
And what's happening with Muni?
Right now we are going to renew our contract this year. So we want a fair fair contract for all the city workers.
And they say there are not enough operators.
Yeah, because they're not hiring enough people.
Why aren't they hiring enough?
I'm Pete Wilson, Executive Vice President, TWU Local 250A. We represent transit operators and the SFMTA stopped training people during the COVID pandemic, so we're way short on operators. But not only that, we represent disease control investigators who are supposed to be tracking diseases such as gonorrhea, HIV, and most importantly right now, COVID-19. And yet instead of hiring permanent, full-time qualified people, they're hiring part-time workers to make these calls instead of having professionals. We also need more health inspectors who we represent, automotive service workers, fair inspectors, and curators.
Why aren't they hiring regular workers, city workers?
That is, you know, you would have to ask the mayor that. We've had many conversations where they have more than enough employees, more than enough money to hire the employees.
They've gotten a lot of money, hundreds of millions of dollars.
Gotten a lot of money. We've had people retire. We've had people be promoted to other positions. We've had people be released because they didn't want to get vaccinated and they want to. And oddly enough, the city has said that people, by law, could get religious exemptions, and yet they've only granted 2 religious exemptions. They promised weekly testing, and yet people who I have spoken to who have legitimate religious reasons not to get vaccinated have been denied.
Why?
That's a great question. Why? We have leadership here, I believe, that does not like to be told what to do and wants people to fall in line. And actually, the head of DHR did say that it is a financial issue as well. Because, you know, originally they said they wanted people to get vaccinated so they didn't get sick. Now we know people do get sick whether they're not vaccinated or not. I've been vaccinated, but I am just as good of a carrier as any other non-vaccinated person. And right now our buses are overcrowded. They're packed. And yet you got 30 to 40 operators who are being released. It would be better for the safety of the people of the city and county of San Francisco if you let them operate and relieve some of that overpacking on the bus.
Isn't that a health and safety danger to have overpacked buses?
It is an extreme health and safety, you know, that increases violence, violence against operators, violence against passengers, also the spread of COVID and other communicable diseases, and then just the fact that I've seen people twist an ankle or get hurt falling off just because it's so crowded on a coach.
Does the mayor know about this? Does the mayor know about this?
The mayor? Is that what you said?
Does she know about it?
Yeah, I believe the mayor used to ride the bus.
Does she know about the overcrowding in the buses?
That's a great question. The 6 Parnassus is not running right now. The 7 is, but I don't know that she's riding it. 21 Hayes used to go right here, which runs right through District 5. She was our supervisor in District 5, and it is not running. So I don't know how much she's taken the bus. I'm sure she's heard about it, but you know, the 14 Rapid, the 38 Rapid, the 8, the 30, these popular lines are extremely crowded, and we need relief.
It sounds like a health and safety danger.
It sounds like a health and safety danger to me as well.
Is OSHA here?
Is OSHA here?
Yeah, has OSHA inspected your conditions?
We answered the call.
That's a great. That's a great question. I would hope that they would.
Have you seen them?
Have I seen OSHA? No, I have not.
Where are they?
In the OSHA office? I don't know. What do you mean? Where are they?
You're out in the streets. You're on the buses. Where's OSHA?
The city said they didn't have funds.
That's, you know, I don't know if they wear an OSHA badge or a nice vest that says OSHA on it, so I can't tell you.
But you've never seen them.
Incognito, I think.
You've never seen them.
I have not.
Because I am not taking a shot. That's why.
City
Him and I were juggling state legislation.
Have you been fired?
Strikes.
Not yet.
And in that moment,
what's the union doing about it?
When the city got shut down, and many of us didn't even know if it was safe to see our family or go to the grocery store. The city and county of San Francisco filed collective vector. Now,
Julie, I'm an ER nurse. We do not have enough nurses at the general or in DPH.
Well, how does that affect treatment or the treatment that people get?
It's not safe for our patients. We aren't able to provide as good a care as we would like to, and the services that they're promised aren't available.
Why aren't there enough nurses?
Huh?
Why are there not enough nurses? The city has all this money. Why don't they hire the nurses?
That's the same question we've been asking. What is HR doing? What are we doing with the money? We don't know. Where's the money going?
How long have you worked at General?
I have worked at San Francisco General since 1999, so for quite a while.
Is there a danger of outsourcing, privatization?
Absolutely.
What kind?
Well, you know, part of the big danger, particularly to this city, is our population needs people who are dedicated to serve them, and people who are contracted, not against them personally, but they're just here temporarily. So they're not invested in our community as DPH should be investing in.
Teresa Foglio Ramirez with Labor's Local 261. We're out here to tell the city to quit starving the personnel and to staff up for our essential services.
How does that affect the public when they don't staff central services?
Well, it's like at Public Works, they have 78 vacant labor positions in operations. We're the ones that do the street cleaning, the pest abatement. And you can look at the street. That's how it affects the citizens. That's how it affects us, is that we need to staff up now.
But they have all this money. Why aren't they using it to clean the streets and hire more people?
They kind of hoard it and use it as a little slush fund to do their pet projects. I mean, there's no other reason. I mean, if they 78 laborers down, we have a solution for that. It's called a hiring hall. We have 200 people on the out of work list. We can fill those vacancies while they go through the civil service process and hire permanent people. So there's no excuse not to fill them.
And isn't this a health and safety issue if the streets aren't clean? I mean, you know.
Oh yeah, it's a huge health and safety issue, and we have similar health and safety issues. I mean, you know, no restrooms. They need to do. They need to do.
Don't have any restrooms?
No, that's a big public fight.
Why can't they have restrooms for city employees?
Well, it's for the laborers only, and because we've just filed a lawsuit for retaliation on whistleblowers. That's why we believe we don't have bathrooms.
What happened with the retaliation?
We blew the whistle on Muhammad Nuru and Harlan Kelly, who were indicted, and I think it's payback.
What do you mean payback?
Well, they're not really happy with us for turning them in. I mean, you know, usually whistleblowers that should be celebrated, some places are punished.
Are you concerned about privatization? It seems like these business districts, they got a lot of people out there who are doing your work, but are not being paid any kind of living wage.
We're concerned for the workers, really, because it's under the guise of workforce development that they're training them, but they never connect them to true apprenticeship. So no matter how long they work there, they don't get connected to that journey level status that can provide them health care, that can provide them with a pension, a decent living wage. So no, they're being exploited, we believe.
And is contracting out? I mean, it seems like they're doing a lot of public work, but they're not public workers.
Yeah, I mean, but once again, it's the workers who suffer. I mean, you know, the citizens suffer, the workers suffer. When you contract out and privatize, you also lose control. So, yeah.
Who's doing the oversight of these workers?
Your guess is as good as mine.
Is there oversight?
Yeah, I mean, we wish they would audit the work that's being done. If it's a workforce development grant or contract, let's see what the outcomes are. Let's see how many people are connected. So we definitely need an overhaul of our system. That's why we're out here.
And the city people who are complaining about the lack of street cleaning, you're saying it's directly connected to the fact that you're understaffed.
I mean, we could talk about it all day long. I could tell you all kinds of things.
Tell me some specifics.
Yeah, so no, it is. It's connected. Like when we were in the recession, they took away many of the mechanical street sweeping routes. Once we got a fat budget, did they bring them back? No. They used that money for something else. It's all a result. I mean, some of this is results of corruption, and some is just mismanagement. But either way, we deserve a change.
And who has been retaliated against for whistleblowing? Are they here?
Well, they're not here at this rally, no.
They were retaliated.
I mean,
You were punished?
Yes, we were told by people in the administration that what we did was scorched earth and that we were in the doghouse.
I'm Cheryl Thornton. I'm with SEIU 10-1. I'm the Vice President of Community Health Chapter. I'm here with some of the members from Community Health Chapter, Donna, Karen, Peter. So we're out here today at this rally, and we were told to come down here because we were told that this was about bargaining or contract.
turn them signs upside down. This is the real truth.
And yet I get a text message, this is about filling temporary workers now. And I feel like this Staff Up campaign is about outsourcing and privatization of public work. We've been down workers. Why aren't they talking about the working conditions that we've been working in during this whole pandemic? I lost a worker, Ludwig Lioto. He died being an essential worker. We still don't have protections for our essential workers. We still need equal pay, but yet they're concerned about the temporary workers. What about the workers that are here now? What about the racial inclusion that's not happening? We need equal pay for equal work, and we do not need our union to continue privatizing city services.
How are they privatizing city services?
Well, through this TEX, they have all these contracts that came in through COVID, and a lot of these people that are temporary workers are under these contracts. And they're coming in.
How many of them are there?
I don't know, there's thousands. I mean, in our department alone, I believe they said there's about 4,000 openings.
For TEX workers, but they don't want to hire permanent city workers.
No.
What are the conditions for these TEX workers?
They actually keep our salaries down because they undercut us with seniority, for overtime, for things like that. But what I really want to say though is that this privatization is an attack on the working class people of San Francisco. We could not afford to stay here. Inflation is gone 7%. We need our raises, we need health and safety, and we need the the government of the city and county to play fair and stop privatizing public work. We fought for this for many years. And so we want to retain public work because it's important to people of color. We can't get access in the private sector like other people. And when we go to the private sector, working like with Amazon, we get paid $15 an hour and we have to travel for 2 hours. How is that? No. We need to protect city workers, protect our retirement, protect our health benefits, and give us better working conditions.
My name is Donna. I'm a medical assistant at the Tom Waddell crew. This is Peter. He also, and he wants to say something too. Go ahead, Peter.
I think one of the big issues with medical assistants is we have been trying for so many years now, asking for a pay adjustment. We're pretty much one of the lowest paid people in the whole of, the city and county. People, just do basic services within the city and county get paid more than us. We have to have a license. We have to go to school for 2.5 years, and every 2 years we have to go renew our medical license, medical assisting license, and also our phlebotomy license. And we just want a fair pay. We do such a lot for the clinic and the city and county, looking after all the patients, and we're just asking for a pay adjustment. Rather than being one of the lowest paid people in the city and county, we do a lot. We do just as much as an RN does, and yet we get paid, about only 40% of what they get. I mean, we just want a few more dollars so we can actually live comfortably and be able to afford to live in the city. It's expensive. It's not nice to month after month to be struggling paycheck to paycheck when we do such a lot. I just don't see why people just look at us as doing a very basic job. We are very responsible for a lot of things, injections, EKGs. We're very talented people, and you can ask our manager and any other members of staff. We are the core workers in the clinic. We run the clinic.
Are you concerned about Health Rights 360?
Yes, because they're privatizing and it's not right. And so that diminishes us as MEAs again, that we're worthless to the community, but the clinic couldn't run without the MEAs. And so we just want steps. We want to make money where we can afford to live in San Francisco, not drive 3 hours away. We want a living wage, and we deserve it. I've been here 22 years with the city. 3 children I've raised up college. We just want fair treatment. And now they're trying to privatize with Health Right 360.
So Health Right 360 is a private organization that our union organized of healthcare workers, and they're union busting. They're taking public work and privatizing it. This is what is going on. And as far as, that's really what's going on. And so they can't pay the workers. They can't hire the workers because The city and the union is engaged in union busting. They are privatizing public work.
And they're giving to another entire healthcare system. Healthcare 360 is like a parallel health system, isn't it?
Right, it's like a look-alike. It's a pseudo public health department that's been privatized, so the workers don't have the same benefits. They're not part of the city charter. They can't go to civil service. They don't have the retirement with the health benefit and the paid benefit. This is what they don't have, and this is what they're after. So the city has found a way, I believe, to figure out how to privatize public workers and get rid of them.
Well, why would the union do that? Why wouldn't they protect public service?
Our union is in bed with them because they organize Health Right 360, and now Health Right 360 used to be part of the San Francisco Health Network that was the lines of business for the health department, and now they're San Francisco Clinic. They're their own network. They've even taken, I don't know, probably over 50,000 of our patients away. So, I mean...
Is that union busting?
Absolutely. How do you take a private company and put them side by side with us? You know, those aren't public workers, so that's union busting all the way. And that's why I'm here today, because I'm really upset about that.
Thanks. It could mean the closure of the clinics.
Exactly. Well, that's what I foresee when the numbers go down and the redistricting happens after the census. You know, these processes that are in place. Then next thing you know, the demographics change in that district and we don't need these clinics. But it's all connected together. So what has to happen is we need to educate our members at a grassroots level as to what is going on, because they don't understand what's at stake. What's at stake is privatizing public work, not having the benefits of a retirement and a health benefit, and that is so important after working for 30 years or 25 or whatever.
Andrew McCarran. I'm here today to support all the carpenters and all the other trades. They need to fill vacant positions and everything and make sure the city still runs as efficient as possible.
How is it affecting the city?
What's that?
How is it affecting the city?
I think what it does is it ends up when a person retires or moves on and everything, it leaves a vacant spot. And then with that said, then the people that are still there, they ask them to step up, which most of them do, to continue the work.
And what about stress? Are people stressed out?
Some people are stressed out and everything. Everybody manages it a different way. Myself, I'm okay as far as I do my best to step up. I've been with the city for 26 years and I'm glad to be a city employee and I really enjoy my job. I'm the carpenter supervisor at the cable car barn.
What's your name?
Elizabeth Milos, member of UPTI and also a delegate for UPTI for the San Francisco Labor Council. I'm here to support the city workers, and especially because we need to stop the privatization of city jobs and the outsourcing of city jobs. I work for University of California, San Francisco. I'm a medical interpreter, and the healthcare workers have also been facing a lot of the same issues that city workers are facing, and in terms of difficulties in a lot of ways, the workers, city workers have had it really rough these past few years, and the pandemic only exacerbated that. And UCSF workers as well. The University of California has medical centers that have been dealing with a lot of patients, and the healthcare system needs to be completely revamped. We need universal health care as well. And
do you think they've used the pandemic to privatize and outsource?
I think that the government has been using the pandemic as an excuse for many things, including to privatize, and to outsource. Saying that there's not enough money, but there's enough money out there. California has a lot of billionaires, and the whole privatization thing, we're all connected some way or another. The school closures in Oakland is connected to the port privatization, and where they're trying to take away the Howard Terminal from the ILWU, a job source for the international longshoremen, to set up a condominium in Oakland, and everything that has been going on here is the same culprits or the privatization scams that are going on. The Fisher family, the Fisher dynasty of the Gap has been also involved in trying to take away the Malcolm X classroom here in San Francisco. So it's an attack on workers and it's an attack on people of color as well.
Julie? I'm an ER nurse. We do not have enough nurses at the general or in DPH.
Well, how does that affect treatment or the treatment that people get?
It's not safe for our patients. We aren't able to provide as good a care as we would like to, and the services that they're promised aren't available.
Why aren't there enough nurses?
Huh?
Why are there not enough nurses? The city has all this money. Why don't they hire the nurses?
That's the same question we've been asking. What is HR doing? What are we doing with the money? We don't know. Where's the money going?
How long have you worked at General?
I have worked at San Francisco General since 1999, so for quite a while.
Is there a danger of outsourcing, privatization?
Absolutely.
What kind?
Well, you know, part of the big danger, particularly to this city, is our population needs people who are dedicated to serve them, and people who are contracted, not against them personally, but they're just here temporarily. So they're not invested in our community as DPH should be investing in the DPH.
What's your name?
My name is Rosemary.
So what are your concerns about being out here today? What are the issues?
Well, I'm here to support the union today that the city say yes to all our demands and all that we want them to do for us. We want them to come to the table and accept all our offers.
Do you have a problem with staffing?
Yeah, we have problem with staffing at Laguna Honda. I work at Laguna Honda Hospital. I'm a PCA there, and then we have staff issues that usually we always short at work. Yeah, so we need more. We need them to employ more staffs. So because it's all about the patient, especially because we have to, so that we can have 100% care for the patients, which is the number one priority why we are there, to take care of the patients. So
have they been hurt? Have the patients been hurt by the lack of staffing?
Well, you know, they will not get the 100% care like it used to. Let's not deceive ourselves. For example, when you have too many loads of patients on your hands and then short staff, how do you take care of those loads of patients? So it's all about the patient, number one. Yeah, so we need more staffs. We need the city to employ more staffs for us, which is more important because of the patients. Because the patients are a priority, that's why we are there. If no patient, we won't be there to work. So we need them to really come there and do what they're supposed to do for us and help us.
My name is Rob.
What's going on?
Well, I lost my job of 23 years with the city.
What kind of work did you do?
I supervise a team of 6, and everybody's working.
What department?
DPH, and everybody's working from home, but I'm too dangerous to even work from home because I didn't get all the vaccines.
So you're working at home and they're still terminating you when you're not?
Yep. Yeah, I've been working from home. I've been in my office less than 5 days since March 2020. My cubicle misses me, but I can't even work from home because I'm too dangerous.
What did they say?
They say they put me on unpaid leave. I don't even have an income right now, just because of my medical choices, my personal medical choices. It's unprecedented, and they're out here. The obvious answer here: rehire the vaccinated staff up. Duh. I mean, seriously.
What is your union? Is your union defending?
I'm sorry?
Your union. What is your union saying?
They're missing in action. After all these years of paying them dues, they're missing in action. They didn't help us at all. Not one public demonstration, not one even public statement in favor of us.
How many are there?
There are 4,000 workers, at least in the city, who are losing their jobs or in process of losing their jobs because of their personal medical choices.
What do you think about that?
I think it's horrible. I think it's tyrannical. I think it's fascist, and I think it's got to stop. And I really wish, you know, there's so many other states. If they picked up my office building and flew it, for example, to Florida or Texas or somewhere else, I could waltz into the office without a mask even and sit down and supervise my team of 6. But because this is California and because it's Newsom and because it's London Breed not standing up for her workers, I lose my job.
My name is Tina San Camaro. I work for Rec and Part. I'm here to rally because, you know, we need to show the city our collective power. We have 3,800 position has not yet been filled, and the city has over $1 billion reserve. So we're demanding our fair share. They've been crying that they don't have money, and the position's still there, vacant.
What does that mean for services? Overwork, stress?
Yes, that means a lot of us, overwork. We have to work overtime. Sometimes some of the staff members, they've been building up too many hours. They work overtime without even getting compensated.
And are you concerned about privatization?
I'm sorry, say
Privatization, outsourcing?
Oh yeah, that is another concern, because that might be something that we need to look. 3 years ago we already looked into this area, but we'll continue on this topic.
How are they keeping the city going if they have all these empty positions?
That is a very good question. That's a question we want to get answered by the city officials, because a lot of workers been really overworked, and they don't even have time to go on vacation, and their vacation hour is way over the limit, and they cannot even get the money or hours that they deserve for.
And how is that the pandemic and the COVID, has that affected stress and what's going on with that?
Well, the pandemic definitely take effect, but city worker, most of our co-workers, they really handle it very nicely, and we work really hard even during the time. A lot of members are deported out for emergency response and to handle the pandemic, which the city actually in that situation did not really look in that way, so to give us any benefit on doing that. My personal experience, we don't deal with too much to the public, but definitely there will be a shortage of staff handling, because limited time that we can offer to the public, as pandemic going on, still a lot of people are not ready to go back to the office.
Nurse from the general and the ER. We have not had enough staff for the last few months, and they're having a really hard time hiring. Our HR is really slow at getting us new nurses, and we need to staff up.
Is that affecting the patient care?
Definitely. We've had really long wait times. We've had patients in the hallway during COVID. Yeah.
So, in the middle of the pandemic, you'd think they'd be hiring more people.
They're trying, but our HR is really slow. They staffed up at the beginning of the pandemic, but for Omicron, they have not been able to.
Is there a problem with privatization and outsourcing?
We do have a lot of travelers, and we would love to have more 2320s, permanent staff. I think it's because HR is really slow, and they've had trouble retaining current workers. We've had so many nurses leave over the course of the pandemic from burnout.
Is that because of the stress or the pandemic?
Yeah, definitely.
What is it like being a nurse at General Hospital?
I love it, but it's definitely stressful.
Having not enough staff makes it even more stressful.
Yeah. It would be amazing if we had enough staff. It would be so much better.
Well, the budget of the Department of Public Health is massive. They got all this money from COVID. Where's that money gone?
I have no idea.
They got a lot of money from the government. How long have you worked for the city?
2.5 years.
My name is Roger Marenko, President, Transport Workers Union Local 258. We're having a big rally here today. Let the city and county of San Francisco know, don't with us. Don't with us, because our contracts are coming to an end very, very soon. And if we don't get treated with dignity, respect, and with the essential services that we are demanding as essential workers, well, then we will shut this city down.
Who's caused the fact there are not enough buses in the street?
That's the city and county of San Francisco at its best, canceling service, reducing runs, eliminating bus lines, essential bus lines. So that's the city and county of San Francisco at its best for you.
Is there an issue of privatization, outsourcing?
Absolutely, and that's also going to be one of our hot topic buttons of discussion in terms of protecting jobs for humans as opposed to jobs for robots. So that's definitely on the list in terms of contract negotiations and proposals that we're going to be bargaining at the table.
Automated robotic buses taking your jobs?
It's definitely a threat, hence the reason why we are doing everything that we can in terms of educating our membership, organizing our membership, so that when the time comes, we'll be ready to take action. And if that means shutting this city down, well then, so be it.